Do you or your friends play pickleball? If that's the case, you're not alone. Pickleball is the fastest growing sport in the United States, with an average annual growth rate of 11.5% over the last 5 years and over 4.8 million players countrywide. Although pickleball requires less running due to smaller courts, it can strain a player's feet and ankles. According to a 2018 study, the annual number of senior pickleball injuries equaled the number of senior tennis injuries that year. This isn't surprising, given that, like tennis, pickleball includes repetitive pounding on a hard court, which can lead to Achilles tendonitis and heel pain. Furthermore, sudden side-to-side motions and directional shifts can cause ankle sprains and other lower extremity injuries. In this video, we'll look at the most common pickleball foot and ankle injuries, as well as their remedies and strategies for prevention. But before I do, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook called The Complete Guide to Stopping Heel Pain in Runners, a book that is very useful for pickleball players. You can download a copy by clicking on the link in the description below. Also, if you find this information helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. Now, let's first address acute injuries. These are injuries that occur suddenly, such as spraining an ankle or falling after a sharp turn or pivot. Ankle sprains are one of the most common injuries seen in pickleball due to the specific movements needed to play the game. Swelling, discomfort, and bruising are common symptoms, as are acute pain and difficulties walking. Get an ankle sprain treated as soon as it occurs. Initially, the Rice rule really works. Rest, ice, compression, and elevation are used to minimize swelling, inflammation, and pain. It's critical to see a podiatrist for x-rays or an MRI to rule out any serious injury. You may also need to wear a walking boot and use crutches if your injury is severe. Physical therapy may also be recommended to improve strength and range of motion and help healing. Other treatments and information about prevention can be found in the link in the description below. Pickleball can also cause ankle fractures. Treatment is similar to that of an ankle sprain. Imaging can determine the degree of fracture as well as any other damaged ligaments and whether, in fact, you may need surgery. A third acute injury is an Achilles tendon rupture. This tendon can rupture when the tendon is stretched beyond its capacity, which can happen during pickleball's twisting, fast motions. Older players, those with a history of Achilles tendonitis, and those using medications such as steroids or specific antibiotics are at a higher risk, as these may weaken the tendon, increasing the likelihood of a rupture occurring. If you rupture your Achilles, you'll probably know it. You'll feel a stabbing pain in the back of your ankle, and you'll likely hear a popping sound or snapping sensation. You may then have great difficulty walking, particularly uphill. Treatment is very similar to an ankle sprain, only the need for surgery is more likely. Now let's look at chronic injuries in pickleball. These types of injuries develop over time due to the frequent play. Inappropriate footwear, hard surfaces like a pickleball court, and poor foot mechanics all can contribute. Two of the most common chronic injury conditions are plantar fasciitis and Achilles tendonitis. They can start out mild and then worsen gradually. Additional risk factors for these two conditions are age, tight calf muscles, and being overweight. In plantar fasciitis, the plantar fascia becomes inflamed as the foot stretches. This is a ligament that runs from the heel to the ball or base of the toes. You'll notice pain in the bottom of your heel and possibly your arch when you first get out of bed in the morning, with pain easing up as you move forward, move around, and then worsening as your day progresses. Because of the multiple factors involved in developing plantar fasciitis, Comprehensive treatment is often required. Aside from rest, successful treatment can include reducing inflammation with use of taping, orthotics, stretching exercise, laser therapy. It may also include a change to more appropriate footwear, and in certain cases, physical therapy can be very beneficial. Now let's talk about Achilles tendonitis. As I just mentioned, Achilles tendonitis shares many of the same risk factors with its cousin, plantar fasciitis. In addition, pickleball players who take particular medications called fluoroquinolones like Levaquin or high blood pressure medications are also more vulnerable. You'll notice mild pain from the back of the heel to just below the calf, from here upward. This will gradually intensify with time. Treatment methods are similar to those used for plantar fasciitis. Inadequate treatment can lead to Achilles tendinosis, a degenerative condition that can lead to rupture. This may require surgery or injections to repair it. Another common chronic problem in pickleball is a stress fracture. Stress fractures can result from faulty foot mechanics, unsuitable or worn-out shoes, increasing your pickleball play too rapidly, and running on hard surfaces. Also, underweight and postmenopausal women are at a higher risk due to the bone loss often found in these groups. Symptoms may include sudden onset of foot or ankle pain that resolves with rest, as well as pain, swelling, redness, or bruising near the top of the foot or the ankle. To recover, you'll need to take 6 weeks off to rest and keep your foot immobile in a walking boot. Injury prevention should always be a top priority. Here are some important pickleball foot and ankle injury prevention steps. First, pickleball requires proper footwear. Choose a badminton, racquetball, or squash shoes for indoor play and tennis shoes for outdoor play. Running shoes, which normally have a little bit more elevation, are really not appropriate. Your footwear needs to provide foot and ankle stability during lateral movements and twists. Be sure to measure your feet to ensure proper fit and wear any inserts or custom orthotics you need to keep your feet properly aligned. You may also want to visit the website Pickleball Central to purchase your shoes. I'll put a link in the description below. Second, choose the right socks. That's right, socks can make a big difference. Pickleball socks should wick away moisture from your feet to prevent blistering. You can also visit Pickleball Central to purchase your socks or ask for these types of socks at a store such as REI or another athletic shoe store you trust. Third, increase your playtime by no more than 10% per week. This allows your body to adapt and build the necessary muscles for the game and develop better elasticity to avoid injury. Listen to your body. If you feel tired or having any pain, stop and rest. This is particularly important for older, less active players. Fourth, wear appropriate inserts. Most shoes do not come with adequate inserts. Even in a good shoe, if you pull their insert out and look at the bottom, you'll see it's so flat and the insert is really not sufficient. Even if you don't suffer from heel pain, it's a good idea to replace the ones you have with an over-the-counter insert from a company like Ready Orthotics, Power Step, or Superfeet. These will help with foot aches and fatigue. If you have faulty foot mechanics like flat feet and inward or outward tilting of your foot, you may need custom orthotics. Go to a podiatrist to receive an evaluation and ask if they also do a gait analysis. If you do need them, be sure you wear them every day, every time you play to prevent heel pain and flare-up. Fifth, stretching is also crucial before and after you play to prevent plantar fasciitis and Achilles tendonitis flare-ups or an Achilles tendon rupture. Incorporate stretching into your routine to enhance flexibility and reduce the risk of injuries. I'll include a link in the description below. Sixth, eat a healthy diet. It's critical to eat a healthy diet to keep your energy up and to prevent a stress fracture. A diet with plenty of foods rich in calcium and vitamin D can also keep your bones strong. Seventh, do conditioning exercises. Conditioning workouts can keep your body prepared for the next time you're going to play pickleball. Before beginning any fitness plan, consult with a healthcare practitioner, especially if you have chronic diseases or you've been inactive for a long time. I'll include a link below to a video showing some great workouts just for pickleball players. In conclusion, you can dramatically reduce the chance of injury, improve your overall pickleball experience by taking these precautions and being sure to get podiatry treatment if you end up with any of the conditions we've discussed.